and the groundwork that has been done mainly is the schools on internet governance. Again, a couple of schools, they have had the sessions and participants and speakers, those who have or have the experience of living with disability and experience as well. But then there are schools which have not been forthcoming when it comes to accessibility uh, agenda. Uh, then is the organizations. And if I talk about the organizations, is the iStar organization. There has been a lot of good work done by these organizations, including Internet Society, ITU, United Nations, and ICANN, and all those organizations. But this work needs to be structured and structured in a way where from bottom to top and top bottom approaches are applied at different policy planning and implementation levels. If I give the example of Internet Society, as a person with disability, happen to be the first elected member board of trustees of the Internet Society. And by the way, when I speak here, I speak as Muhammad Shabir and not from the perspective of the Internet Society. These are my own opinions. So I happen to be the first one elected by the chapters at the Internet Society who happens to have any kind of lived experience with disability. But Internet Society, as we all know, for long have been doing a lot of work with regards to people with disabilities and making the internet accessible, digital domain particularly accessible in different parts and regions of the world. We also heard that there is the standing group on accessibility, and then there is also a project of New York, which is the special interest group on accessibility. So all these ventures, they are there, but what is lacking in internet governance discussions is the actual participation of people with disabilities. And this brings me to the second part of my discussion, which is very important as well. As a person with disability, if I stand here and if I claim that nothing about us should be without us, then it should be the responsibility of me to participate in these kind of discussions. And what is observed is that in these discussions, there is less participation of people with disabilities in IGF, in NRIs, and in the School of Internet Governances. There could be multiple reasons for that. I will not go into those details here. If there is an interest, we can discuss this in the latter part of this session. But what needs to be highlighted here is that people who have lived experience of disabilities, the organizations, those who work for people with disabilities, they need to be proactive in becoming a part of these discussions. My last point relates to Ganela's earlier point that there is a need to strategize this and strategize this from the top leadership level with response to the championing or having a champion with regards to accessibility. It is unfortunate that on one hand, it's fortunate that UN Secretary General started a new inclusion strategy back in 2019. But it is unfortunate that when the new IGF leadership panel was announced, there was no person with disability on that panel. So this could have been avoided, and coming from the top, the message could have been very forthcoming and very pronounced had there been a person with lived experience of disability appointed or promoted to that level. But unfortunately, this could not happen. We can just hope that in the future, this could be rectified. Ladies and gentlemen, this is accessibility is and digital accessibility is something which we often say that needs to happen. I say that it is unavoidable, and we can not have the digital domains accessible for everyone, because this is by the humans and for the humans, and humans themselves can make it accessible for everyone if there is a will and desire. And if there is no will and no desire, then nothing can make the internet platforms and the digital domains accessible. But if there is no will or desire, today we should not think just about that this is for every other person, but not for us. Even if we today do not need it or may not need accessibility platforms or platforms which are accessible for different people who have different disabilities, tomorrow or the day after may need it. So physical and temporary disabilities, which may be temporary or which may be permanent, may occur and catch to anyone, anywhere in any part of the life. And as we age, we need these accessibility requirements more and more. So my just a humble suggestion to those who would say that we do not need it, so why do it, would be that today they may not need it, but God forbid that if tomorrow and the day after you need it and you not have it, then there would be no use over crying spilled milk. So with this, I rest my case and back to Judith.
Shabir, thanks so much for your remarks. And I know Shabir is trying to work from the inside out to change, because you can work from the outside, but the best chances of making change are working from inside the system and getting change to happen. And slowly but surely we are doing that, working with different organizations, both within the IGF and others, and trying to convince others of the need to do accessibility. And as he pointed out, main people captioning is not only for people with disabilities. It's also for people whose first language is not English, and it's also for people who have limited bandwidth who can't see the videos. So that is also one of the universal aspects of accessibility. Same is true for a lot of different other things. People, as they get older, they lose some vision and they need to have screens made bigger or other things. So there's a lot of different ideas of what's needed for accessibility. I will next bring it off to our next panelist, Lydia Best. And Lydia, you can take it away. Thanks, Lydia.
Thank you, Judith. Can everybody hear me?
Yes.
Okay, wonderful. So as Judith has mentioned, and first of all, thank you very much for allowing me to speak today and inviting me to be part of a meeting. But it is a huge privilege for me to be able to address, while I am in England, actually a host country, which is Poland, the country of my birth, where I spent my formative years. At the moment, I'm also a vice chair of JCA-IGF at ITU, which stands for Joint Coalition Activity on Accessibility and Human Factors at International Telecommunication Union. And I'm also part of this group of Dynamic Coalition on Accessibility and Disability. I would like to start first, before I talk about general accessibility, and build on what my previous speakers have said, on language and perceptions of disability, where we do require as well a leadership to ensure that people with disabilities are fully understood. In case of people who are hard of hearing and deafened, I wear cochlear implant. For many years, I used to wear hearing aids. In our case, there is predominant assumption that medicine fixes us. Basically, this is especially very strong kind of assumption, which I have noticed in Poland. I don't see it as so much in the UK. And that brings an issue of lack of accessibility, lack of understanding that people who are hard of hearing, well, yes, the devices are life-changing and supporting them, they are allowing them to hear, but not always fully understand, especially digital voices and digital meetings. And therefore, they need additional support, such as assistive listening devices, and especially when it comes to the internet captioning. Now, despite those efforts to improve awareness and access of the needs of hard of hearing people, we still observe the resistance of providing even the basic access in many areas of public life. So most notably when it comes to public announcements, when it came to the COVID pandemic, I have observed many countries, Poland included, which were not providing the live captioning to the hard of hearing citizens. They also were not providing them on actual internet platforms. There also seems to be a lot of misconception around policymakers, and despite the advances, we are not using the technology which is available. But now, while English language users do enjoy long history of investment in training of real-time captioners, who we are using today at this meeting and all the meetings of IGF, re-speakers, and also we are using sometimes automatic captioning depending on whatever situation people use. Users of minority languages, such as Polish language, do not get that. And they are still excluded from the participation in the society. I have just checked with some of the Polish people via social media if this meeting is accessible to them in Polish language, and they said no. Perhaps that there is a room for improvement with different hosts of different countries. But to make that room for improvement, we have to ensure that there is a real leadership which promotes training of professionals providing captioning. At the same time, promotes the legislation and policy which includes captioning, sign language, and any other accessibility which should be afforded to citizens with disabilities in the country. And in addition, funding and investment towards the developing the accessibility in the native languages, the minority languages specifically. In countries which are, as well like Poland, are excluding persons with disabilities, which make up around 15% of the society, are not yet fully inclusive, despite signing up to CRPD, United Nations Convention on the Right of Persons with Disabilities articles, such as 9 and 30, which both relate to access to information. Lastly, we would like to see the involvement of a person with disabilities, a real meaningful involvement in developing policies and developing training, etc. At any areas which we are working towards inclusive society. But please make sure that those kind of engagements are really meaningful and they provide accessibility those persons with disabilities require. International Telecommunication Union has also publish technical paper on accessible meetings, and in addition, an overview of remote captioning. It doesn't have to be only remote, it can be on the on-site, but it provides some building blocks and information of what it means and which ways you can provide accessible meetings. However, that document is provided for the English language papers in minority languages, so we can have a benchmarks to ensure that the full and real quality with accuracy of information is definitely provided to the society. One of the things I would like to touch on, it's something which I came across recently. The Polish Parliament is currently updating the legislation related to accessible elections. This is a great initiative, and I really applaud it that they are looking into it and making all the efforts to ensure that people with disabilities can have an accessible election and participate in elections. But there is a small but in here. There is not real focus on making sure that information is fully accessible to voters in Poland. There is still lack of live captioning as the provision of universal access. And that is something which I would like to synthesize and make others to actually start putting their minds on and checking, are we fully accessible? Are we fully inclusive to our 15% of the society? So thank you very much. And I would not like to talk anymore. And Judith, over to you.
Thanks so much, Lydia, for your insightful remarks. Yes, that is a thing. In many other states, I know in the US, there are strict laws, but that is mostly caused by the different, the Disability Act, and as well as other communications laws, that certain number of hours have to be captioned, and that certain, and TV shows during primetime hours and other movies or any other things. And so there's a big movement in the US to do this, but it all stems from a law and enforcement of a law. And so that is also something that other states have to look into of how do we do this? And if any other country is interested in it, this program is administered by the Federal Communications Commission, which is the US regulator, and they have international visitors, and they can go through and host different topics for different countries on how they've worked on accessibility and disability issues. They also have a fund to give out devices so that people with accessibility challenges can actually get low-cost devices to watch TVs or other equipment. So other countries in Poland, Europe have similar laws, but that is something that I think needs to be more ingrained into the population and ingrained into the law. Our last speaker for today is Judy Okite. She comes from Kenya, and she has been working with the government there and others to work on accessibility. And I did notice that since our effort in the past few years, many more countries in the national regional IGFs have been using either sign language interpretation or captioning. One of the main comments that came out from the NRI session yesterday was that a realization by some of the regional IGFs, especially in APR IGF, where they've always had human captioning. They tried this year to have AI captioning, and it did not work well for them because the AI is not yet there yet to determine and to work well with with English spoken in foreign accents. Although humans don't have that issue as much, machines do. And so there's always a different learning curve on that. So Judy, I'll turn it over to you.
Thank you very much, Judith, and good afternoon, good morning, everyone. I hope we are well. Can I be heard?
Yes.
Thank you very much. Okay, so I will just continue from where my colleagues have left. Sorry, my name is Judy Okite. I come from Nairobi, Kenya. I will just continue from where my colleagues have left, but I would like to take a different angle to it and address the persons with disability themselves. Many times when we talk about accessibility, we assume that every person with disability actually do understand what we are talking about. But many, or rather the challenges that I face is that whenever I am addressing matters of accessibility, more especially like here in Kenya, then we are not in the same page, because the persons with disability themselves, they are not finding an issue with what it is that I'm talking about. And I'd like to take for an example, when I was advocating for ramps into buildings, I had a lot of backlash from the disability community that why would you be advocating for ramps? The steps work fine. They have been working fine for us. And that is one of the things that I would like to address, that because you have a disability and you don't need this particular accessibility, so to say, that we are talking about, doesn't mean that you need to shut it down. You should be able to support it, because just as the previous speaker said, Shabir, that because you do not need it doesn't mean that somebody will not need it later. And so that has been a challenge here. And so even when we're talking about digital accessibility, like just Lydia has mentioned about the captioning, you will find that the deaf community here do not agree that captioning is that important. So you find that we are fighting even amongst ourselves, whereas we should be all in the same page. So for me, I would say that there's a lot of capacity building that's needed, that's required, even for the persons with disability. We need to be able to understand our rights. So what rights do we have, and how can we advocate for them inclusively, all of us together? When we are talking about digital accessibility, what exactly do we mean? And how can we all advocate for it, whether it is affecting you directly or not? When we want to bring together the community, we want the people who are outside of the disability community to understand us, then we also need to understand ourselves. We need to understand our needs, what it is that we want. How can we forge this together, as opposed to fighting one another? And just lastly on that, I would just like to mention, even as we advocate for accessibility, let's do it not just at a national level, let's do it at a regional level. Let's come to understand, are there digital, accessibility experts within our nations? Are there accessibility experts within our regions? How do we bring them together, that we can all be able just to learn together, learn as persons with disability, so that we can, after we have converged and have one voice, then even as we go out and make and advocate, then it is one person talking, it is one voice talking, so that we are not fragmented. We don't fragment ourselves within the same community. Thank you very much.
Thanks so much, Judy. And also thanks so much for all your work you've been doing also with the NRIs and other work on accessibility and disabilities. Now is time for questions. So we look to you, our virtual audience. What questions you might have. And if you could raise your virtual hand through the Zoom portal, if you're in, it is often found in the reaction comment section in the computer down on the bottom, or if you're in the tablet, then it's underneath the 3 dots that say more. So we could ask for people to raise their hands and if they have any questions, and we'd love to call on you. We'll wait a minute or two. But I think while waiting for hands, we might ask the first question to Shabir. And what changes have you been able to make in your first year that you've been on the ISAC board? I know you're going to a second, applying for a second year, and we hope that the chapters will re-elect you. But I know you were making some other, working a lot of headway and making changes in the ISAC board. And so wanted to bring that to you and ask that question to you. Shabir, sorry. Shabir, if you're talking, we can't hear you.
Judith, can you hear me now?
Yes.
Yeah, can you actually, the voice for me was faded, so can you repeat your question?
Sure. My question to you was, what change, during your first year on the ISAC board, what changes have you been able to make as being the first person with a disability on the board? And if you could talk a little bit more about that, I think, because I know we have talked about that beforehand, and just wanted to hear from you what changed, how you've been working on that and changes you've been able to make.
So thank you very much for this question. Yes, as I said in the beginning as well, that Internet Society have been working for persons with disabilities and engaging through different chapters as well as its regional offices as well. Since I joined Internet Society board, I had a couple of purposes in my mind. One was to sensitize the board and the senior leadership through personal examples that accessibility is something which cannot be put at the back burner and be taken out when and where it suits our interest. It has to be at the forefront, and it has to be at the forefront of the organization by any means. So in pursuant to, I'm pursuing that quest, but I do understand that there is organizational mindset that needs to be changed with regards to digital accessibility of persons with disabilities when it comes to the organization mindset. So for now, I've asked for, and the board has started captioning the open forum, open sessions of the board meetings. Each of these sessions is now captioned, and the transcription of those sessions is and would be available from now on onto the website of the Internet Society. For 59 and 60th, 159 and 160th meeting of the Internet Society board, which happened in July, and then this quarterly meeting, the transcript for that should be available. What is my aim here? Aim here is to have Internet Society, or to make Internet Society an organization where every policy, every procurement document, every RFP document considers accessibility for person with disability. And Internet Society should have a person employed as a staff or an organization with demonstrated work on accessibility for people with disabilities. Their content and their message vetted as they vet it from the legal point of view. Because if we consider a legal requirement as compulsory for the organization to follow, same should be the case for accessibility for an organization to follow. If we achieve that level of accessibility within the organization, I would consider my job done. But I understand that that happy day is a little bit late, and we may not see that happy day very soon because of the mindset and the organization culture that is work at play. I hope this answers your question, Judith.
Shabir, thanks so much. We have a hand up from the Bangladesh Hub. And so the Bangladesh Hub, please ask your question.
I'm sorry, I was not muted. Thank you so much for giving me the floor. I just want to know that, during pandemic situation, we face lots of challenges, right? So we are thinking that we are in a new normal life. Even though we face lots of challenges.
Excuse me, the interpreters and the captioners are having a hard time hearing you. So maybe if you can go closer to the microphone, that way we can get them interpreted.
Thank you very much for letting me know. So, during pandemic, we face lots of challenges, right? As a woman or anything. So we think that we are in a new normal life. But even though we are facing lots of challenges, so how are we going to overcome these challenges and what opportunities we can get? Health issues are like important things for us, right?
No, there's a lot of distortion on the line. Maybe you could actually put it in the chat and then I can read it aloud and we can get it answered for you. We're sorry about that.
I'm very good. Thank you very much.
Yeah, that's also the problem in the remote hubs is that the audio sometimes is not as clear as it could be. And the echoes and reverberations from them are making it even tougher for both the captioners and the others to hear it. But one of the also points are that we didn't fail to mention is in the beginning, and we didn't have a speaker, but he's actually our rapporteur, is we also do not want to people forget when they're focusing on accessibility issues, that it's not only people with a verbal impairment, with a hearing impairment or visual impairment, there's also cognitive issues. And the cognitive issues are also extremely important. And they often somehow get left off because many people with cognitive impairments can hear and can see, but they are not able either to vocalize their comments, or that it is often a tougher thing for them to do. And many aspects, especially in Zoom, is that they type it in the chat, and sometimes organizations say, oh, well, the chat is unofficial. And that's why it's very important to sometimes read out the comments in the chat so that we don't forget about our people with cognitive impairments. And maybe we could ask if Peter, I don't mean to put him on the spot, but if Peter wants to say anything, we would love to hear any comments from him.
Hi, am I there?
Yeah.
Oh, it's
Yes.
well, you put me on the spot, so I think it's very difficult to summarize this. I think one of the main issues with cognitive accessibility to bear in mind is that cognitive disabilities are disproportionately representative amongst the young, mainly because it's something that you tend to be born with. So there are more people or more children with cognitive disabilities than all the other disabilities put together, and that's where it has the greatest impact in terms of education. And now, as we're seeing more and more through COVID and so on, online education, online accessibility is having a really the difficulties with digital accessibility are being exacerbated amongst people with cognitive disabilities who are in education, and in particular with children. So, and just to take up another point, yes, we have to be always aware that people will use different means of communicating, and I know for many people like me who are autistic, who always tend to much prefer using text, for example, than speaking. There are many people for whom verbal speech is not always accessible. So using chat and other forms of communication are important. Thank you.
Peter, thanks so much. Yes, and there's also, even in the verbal meetings, chat, some official ones are not considered official. And there's, especially, I know I've been on ITU meetings where they say, oh, well, the chat is not official, so we're not going to read it out, and we're not going to put it in the record. And that is also something that people need to be trained on, that there are people with disabilities who are posting in the chat because they can't verbalize, or they can't get access, or they lose access to the transcription or other parts. And so those especially need to be verbalized. And thanks to our Bangladesh chapter for writing in. The question is, in the last few minutes, they asked, is that during the COVID pandemic, people with disabilities, especially in Bangladesh, face lots of challenges, and especially in the health sector. And they are looking at how do we, besides the education sector where schools were closed, is in the health sector, how do we overcome these challenges? And many of these were, they couldn't bring someone in with them to translate in the hospitals or in other places. Or they couldn't call someone on the phone, and then that often meant that they were denied coverage or they were denied service. And those are also really big challenges. And it's all about awareness. We have to raise awareness, just like when we first went to the Zoom platform, people were not aware that, oh, people with disabilities cannot see the screen. They cannot see documents that are on the screen, that you need to give them a link for a document so they can actually view the document. Many times it was that people were just not aware. They say, oh, I never thought about that. Okay, but then they have to keep being educated. And it's like, oh yes, I have to put that in the chat. I have to put the link in, or I have to send it out to people. There was also issues of visual impairment although a lot of the applications now have ability to put alternative text or other documents and describe images and describe videos, people are just not aware of how to do that. And that is also a major thing. Not that they don't want to do it, they would like to do it. They just are not aware of how they could do it. And so as we wrap up, I'm just going to look around virtual audience and see if there's any other questions that people have, and if they can come to the front in our last minute. We would love to hear from them. If not, it's been a great, it's sorry the meeting is so rushed, but we had only an hour time slot in here. So we just love to hear from you. And if you're interested in joining the DCAD or the IGF accessibility group, please let us know, post in that chat, and our members will get back to you. But I just want to make sure we bring this thing to the close, because I know our time, everyone else's time is valuable, and we have a lot of sessions that are going on back to back. So thanks so much, and hope you join their other accessibility sessions in there. So look at them on the schedule, and hopefully you can join them and work, and we can make the community more accessible so that the internet will be for everyone and not just for people who don't have a disability. So thanks so much.